as part of the major focus of ours. And the reason for it is I'm in public health, and we deal with all the deans of medicine across the world, and there's no training about agriculture in our schools. Here, the two primary forces of health in the world are health and agriculture, but public health schools, which I'm at, have no training. And if you look at agriculture schools, that's why it's great talking with people today, they have no training in public health. So the idea is starting to use the super course of science and focusing on this pairing initially, because we have everything set up for health, we can do the same thing for agriculture. And this was presenting our sessions last year in 2010, which began to frame the framework, and what I'm going to talk about is some of the developments since 2010. And these are the advisory board that we talked about, who are incredibly good friends and been very, very helpful. And the super course of science that Noah presented. And then basically, as we started to work with Noah and Ajay and Magdi, it's just like, oh my God, these are really technical people. And we've been developing our stuff, and all of a sudden we saw how technology really be done. It was very impressive. Okay, well, basically, how do we need to improve global health and global science? Something that has to be effective, cheap, ubiquitous, acceptable, and sustainable. What we think is internet-enhanced prevention and science education. We do not do distance education, and because with distance education, you are using the computer to generate a talk half a distance away. So if I'm teaching to you at the university in Alexandria, I'm teaching to you, your teacher isn't. What we want to be able to do is empower the teacher, and the most powerful tool to improve teaching is to bring together state-of-the-art, up-to-date lectures. And that's part of the problem with developing countries. They don't have access to this, and we can provide that. And so basically, the other component of this is that the concept of what we're developing in science and health is the concept of GLOCAL. And GLOCAL is basically, if you want to learn something in science, if you want to learn something in health, well, you have local information that you can use about the health of your community, agriculture, but you also need to bring as part of it is GLOCAL. So like a person who develops H1N1 in New York can be in Alexandria in 6 hours. So we need to be able to look at the total picture and bring those two together. And what we've come up with Dr. Segledine is basically students of the worldwide should learn from up-to-date science and global health materials. Duh, and it's a very simple concept, but we've developed the technology to be able to make this a way that is actually feasible for very inexpensive. And so what we've seen in health, and the reason that we got involved with this, in health, for 5 million years, up to 1949, life expectancy increased about 20 years. That's so for 1 year gain in life expectancy, it took 25,000 years. I mean, huge. So for thousands of millions of years, we're very slow. But what we've seen now since World War II is that, we've had, for these 60 years, we've seen a 25-year gain in health in just these 60 years. Now that's incredible. And 1 year health gain in life experience took only 2.5 years. And Egypt is phenomenal in terms of the increase in life expectancy in such a short period of time. I graphed it, and basically it looks like in about the year 2020, life expectancy in Egypt is going to be greater than the United States. A phenomenal increase. And we've seen this effect worldwide. So when we're trying to improve health around the world, we have to recognize the fact that the world is healthier now than it's ever been. Okay, the 1949 tipping point, so that basically the rate of increase since 1940 time is over 10,000. I really wish we got some money from Microsoft, but we don't get any money from Microsoft. But if you think of the power of PowerPoint, is that when I was teaching, or Dr. Segledine or Dr. Sauer were teaching, we would basically take and write on a chalkboard, and then at the end of the class, what would we do? We'd erase the chalkboard, boom. Do you know what you're doing when you're erasing that chalkboard? You're killing a lecture. Bang! You killed that lecture, it's gone. But having things put on having things on PowerPoint and on the web, we can basically, it's called green supercourse. We can basically recycle these lectures so that I can use a lecture from Dr. Segledine in my class 5 minutes after he presents it. phenomenally powerful way of sharing our materials. And what the Supercourse is designed to do, we don't have bosses. I hate bosses. I don't deal with bosses. And they tell you they don't deal with me. So we have a very flat structure of faculty members across the world helping faculty members. So if I have slides from Dr. Sauer, I can use those slides, and basically he's helping me, and I can help somebody else. A very simple concept. And the model is we build a large disciplinary network, and we have an open source lecture library, and we distribute the materials back to our lectures back to the network to use and to share worldwide. And basically, we have 65,000 faculty members from 9,500 universities, 174 countries. This is probably the biggest effort that's being done in global health, and it's done done very inexpensively. And the faculty has shown a very dramatic increase over a very short period of time, and we would very much like to get you involved in joining the faculty. This is Eugene Shubnikov, has done a phenomenal job in the former Soviet Union, and he's been the key person, one of the key persons for us, along with Nicholas and Francois and Faina. And Eugene joined us very early on, and one of the reasons that we were very interested in getting Eugene involved is that I'm an American. I mean, the reality is, nobody really trusts Americans. Admit it, you don't trust Americans. Well, basically, if there's an American and a Russian working together, that's pretty darn good. They trust each other, so we can get everybody else involved. So basically, we did it on purpose so that people would collaborate, because here, people are giving us their lectures. I mean, if you think of what your lecture is, basically, my lectures they're my babies. 30 years old, I've been working on them. Well, my field just said, hey, Ron, take my lecture, take my lecture. And that's phenomenal that we saw in terms of the scientists be able to give for free their intellectual property. And Nicholas has been incredible in terms of what he's done in Mexico, in terms of the development, and he's currently developing a journal there too. Well, in terms of cheap, and we tend to be cheap, basically, if you think of distance learning programs, often a distance learning program teaching somebody in Nigeria is basically, it's like half of the gross national product of Nigeria in order to teach. Our program, we wanted to have it so that it's sustainable. For 1 penny, we teach 17 students. So we have 0.06 cents per presentation for it. And so you can't get anything cheaper than this for the better material to produce a major rise. Okay, so we have 5,200 lectures, Nobel Prize laureates, and then basically bringing today global health, the internet, and PowerPoint brings about the Supercourse in global health, and then the extension to the Supercourse of science. And this is what Dr. Segedin said, that's just-in-time lectures. Immediately after a disaster, and we like this. Disasters are really good. And basically, well, we don't really like them for that, but basically, like when H1N1 occurred, Nicholas identified in Mexico one of the first cases that occurred in San Antonio, and basically within 24 hours we had a lecture on H1N1, which translated in 3 days into 11 different languages, including Arabic, Farsi, and Hebrew. We reached 50 million people, and what happens is that we become a trusted source because we're scientists. In China, no one believed the government, no one believed the industry, nobody believed the media, but they believe scientists. And that's what we've seen is that a power of the Supercourse is that we're unbiased. We'll tell you exactly what we think. And then Japan, we had within 10 hours we had a lecture that was translated into Japanese and 11 other languages within 10 hours about the tsunami, the earthquake, and nuclear lectures. Since last year. The future is what Faina is developing is the area of Central Asia. We get a chance to talk about it. Francois is the Colombian Exchange, mobile global health, and this new concept of bringing agriculture and global health together. Okay, well, I want to take a little bit of minutes because if you're thinking about in the future of bringing technology to help health and agriculture to help agriculture, what you need to think about is cell phones. This is one of the most fascinating findings. In 1 year, the number of cell phones will equal the number of people in the world. Now, isn't that totally unimaginable to basically say that I can call from here virtually anybody in the world? What is the implications of that? We don't know. But here, universal connectivity is something that's brand new and incredibly powerful. What our folks is, and this I like this, there's 1.5 cell phones for every European. There's only one cell phone for, there's one cell phone for every 2.4 people in Africa, and there's more cell phones in the world than toothbrushes. Yeah, well, I can listen to you, but I don't want to get close to you. So basically, if you look at the power of the cell phones, the younger generation coming up, we have to learn from them. These are the people who know the cell phones, they know how to use it, they know how to use it for health, they know how to use it for agriculture, and we've got to tap into them to understand. And for me as a public health person, I'll show you why I think this is so important. I've got this from Dr. Seglin's lecture. How can we reach the unreached? Well, guess what? Cell phones. The homeless people in the United States, 40% of them have a cell phone. Isn't that amazing? Rural India, you can reach anybody in rural India. I've talked with my friends in India that basically I can call from here and I can reach any homeless person in India. Because either that person has a cell phone, his family has a cell phone, or the community has a cell phone. This is a transforming agent for everything we're doing in science and health, but we don't know how to use it. I think we have to ask the 18-year-olds how to use it, but there's incredible, this is the future, no question about it. Now, and also for one of our biggest concerns is disabled. And basically, in a way, a cell phone makes a person less disabled because they can reach out and talk and communicate and out of their shell. Wow, man, what a fantastic tool for basically changing the world. And basically all of our things related to disability, we have to view it in a new way when people can reach out through the cell phones. Now, these were the very early cell phones. These didn't go down very well. They try to put them on their wrist or in their pocket just in town. But now we have cell phones for everybody. Now, we are developing the whole area with the library because of Mobile Global Health Supercourse and the idea of Mobile Global Science Supercourse, where we're targeting the cell phones to bring the knowledge down through the cell phones and to work with people. And a Mobile Global Health Supercourse or Mobile Global Science Supercourse is reaching billions of people worldwide to improve global health and science using mobile technology and education. We don't know how to do it, but it can be done. That's the beauty of this. And we've actually created our own app, a Supercourse app, and basically using that as a tool. Now, the area that I'm interested in and actually comes straight forward from one of Ishmael's lectures, is basically the big concern we have in global health and education and agriculture is to reach the unreached. The most unreached people are the 1%. And I don't mean the upper 1%, I mean the bottom 1%. This is where you have an incredible, in the United States, you have a 10-fold increased risk of death for the homeless people. You have a life expectancy for males of 46 and for women for 41. And I mean, it's just horrific health indices, and part of our problem is that we don't look at the homeless. Oh, okay, this is what they've chosen to do. Well, no, that's not true. This is not what they've chosen to do. So what we're trying to do is try to improve the health of the homeless, not by giving them homes, because basically that's not what I know how to do. That's not what epidemiologists know how to do. Epidemiologists know how to prevent people from dying, and so that's what our target is. But also, if you think about it, it's very interesting for a homeless person. And Francois pointed this out really nice, isn't a cell phone an iHome? Basically, much of the functions and security that you get from a home, you can get from a cell phone for $50 versus $20,000. So the issue is, how do we use these cell phones to increase the quality of life and education of those people who are homeless? And the reality is, me as an epidemiologist in the area of health, there's no way that I can help and reduce the root causes of homelessness. I can't stop someone from being schizophrenic. I can't stop someone from being drug addicted. But what I can do is prevent that person who's drug addicted from dying from a drug overdose. So the biggest target now is to improve the health indices and improve and target the homeless, because we don't pay attention to them. And here is the central problem. I talked with Dr. Shankar today, how big of a problem it is here in India too. But it's a problem worldwide that this technology can begin to approach. And so basically we also have a lot of information. We've collected all the